This is the issued degree of
Kristina Sokolovska-Konecki graduated from medical school in 2012. She has the transcript, the test results, and years of experience treating patients in her native Macedonia.
It is a very big deal.
But as a doctor now living in the U.S. with a foreign degree, the Massachusetts Board of Registration in Medicine said Konecki needed something more.
You have to go through the process of residency, the match, so-called.
The match is a big deal, especially for students who've just graduated from medical school. They're required to get this on-the-job training at hospitals and doctors' offices. And since experienced doctors from foreign countries need it too, they all compete with each other to get matched.
And of course, people who come from medical schools, you know, they know the system. They have the advantage of the language and being fresh and having research done and having worked with patients. It's just so many advantages that kind of makes it more difficult.
So Konecki told her husband it's going to be tough.
We said we're willing to move to Alaska, Arizona, anywhere where you can get a residency. Yeah, I applied over 200 programs all over the country, everywhere. And I didn't get a match. I didn't get a residency.
Without a match, Konecki couldn't treat patients here. The longtime chair of medicine at Tufts Medical Center thought that's ridiculous.
Someone that's taking care of patients and can show they've done a good job in another country should be welcomed here.
Health officials say Massachusetts needs the help. Even though the state has the highest physician-to-patient ratio in the U.S., many people still can't get appointments.
The thing that shocked me, in the past year, I've had physicians call me up and said, Deeb, help us out. I can't find a primary care doctor for myself. Even in Boston, it's hard to find a primary care doctor. But the further out you go, it's almost impossible.
Dr. Salem worked with other experts to propose this solution. Take doctors who've worked in other countries, drop their residency requirement, and instead offer mentorship at specific healthcare facilities in underserved areas of Massachusetts. Governor Maura Healey recently signed it into law as the Physician Pathway Act.
A busy primary care doctor takes care of, 1,500 to up to 2,000 patients. So just even one person go into a community that can take on this thing, they'll get filled very quickly.
Doctors who do well with supervision will receive a limited license to continue practicing medicine independently. For Konecki, it's an opportunity to get back to the job she loves.
You know, when you have that calling, when you know what you want and you're ready to fight for it in any possible way, then, you can make it happen. As long as I know that I can work as a doctor and be there for the patients, everything else comes after that.
The law's supporters believe there are doctors with foreign degrees throughout the U.S. who are frustrated with the rules and regulations. So if Massachusetts offers a chance to practice medicine again, more of them may choose to relocate here. Ben and Erica.
Yeah, it's such